Hi, good afternoon. Greg Mendoza from the Manila Times. I'd like to ask lang po kay Dr. Chavez. Kay Dr. Chavez, yun nga, na-mention ko na po, nakita po natin yung experience ni Nanay Neria na hindi siya nag-ismo, pero nagkaroon siya ng lung cancer. And I guess, marami din tayong mga Pilipino na na-experience din yung ganitong na-experience na hindi sila nag-ismo, wala silang bisyo, pero they are getting lung cancer. Ito po ba ay parang sabihin na natin, due to genetics na rin po ba? Or dahil ba sa mga kinakain ba natin? Or dahil sa lifestyle po ba natin? Kaya meron tayong mga nagkakaroon ng lung cancer, pero hindi naman sila nag-smoke, hindi naman sila, or even kay second-hand smoke, hindi sila nagkakaroon ng second-hand smoke.
Salamat sa tanong na yun. Importante yung natanong ninyo na yan. Kasi nga, nakita sa mga, lalo na sa mga Asian women, meron ng mga porsyento ng pasyente na hindi naninigarilyo, hindi exposed sa second-hand smoke, pero nagkakaroon ng lung cancer. Yun yung mga pinag-aaralan pa ngayon. Yung mga nabanggit ko kanina ng mga criteria, base yun sa pinag-aralan sa mga pasyente sa US at saka sa Europe. So hindi siya based sa Asian population. Merong mga ongoing studies ngayon sa Asian population. Nakita doon na yung mga may certain age, mga age ng women na merong family member, merong kapamilya or nasa lahi yung nanay at tatay or mga kapatid merong cancer, screening nila, nakita na nakaka-detect yung low-dose chest CT scan. Pero hindi, it remains to be seen kung yung low-dose chest CT scan doon nga sa portion ng mga pasyente na yon ay nakakabawas na ng taong namamatay from lung cancer. Kasi hindi din naman natin gusto kaliwat kanan maglo-low-dose chest CT scan. So yun yung pinag-aaralan pa kung pwedeng isama ba yung Asian ethnicity, woman, at saka non-smoker, at saka with the family history lang ng lung cancer. Yun yung pinag-aaralan pa kung meron. Yung mga ibang patients naman na, kasi di ba, smoking yung pinaka-common na cause ng lung cancer. Pero yung nabanggit nga ni Dr. kanina, yung second-hand smoke exposure. Pagka palaging kasama isang taong naninigarilyo, good as smoker ka din. Pag exposed ka sa mga outdoor and indoor air pollution, kagaya ng mga yan sa labas, polluted ang air natin, o kaya pag sisiga, yun, pwede yun. Tsaka syempre yung predisposition din, yung nasa genes, nasa DNA, yung pagkakaroon ng lung cancer.
Okay po, Doc. Thank you. Kay Doc Valentes. Doc, yun nga, dami nga nating treatment options for lung cancer. I mean, we evolved from radiotherapy to surgery to chemotherapy, and now we are now into targeted treatment. Siguro, ang tanong lang siguro is, nag-evolve din ba ang presyo ng mga medical treatments po ba natin? Kasi I understand na po na whenever we go to a new treatment, it's always getting more expensive. I mean natin, medyo nagmamahal siya because it's a new technology, it's a new innovation natin. So, how can Filipinos be able to experience the best cancer care na hindi naman nakakabutas ng bulsa?
Sir, it's true that the medicines, especially they spend a lot in doing the research and all the innovative agents, they are generally more expensive than the so-called the traditional, those which were discovered earlier. But our government, Department of Health, as some of you may know, has the so-called Cancer Supportive Palliative Medicine Access Program, basically covering the chemotherapy, which includes the chemotherapy for lung cancer. And the coverage has expanded. Before, it used to cover only for breast, but now it covers all indication. This is DOH, no? This is not a specific hospital alone. So specifically, especially for the DOH hospital. So there is a medicine access program. And in addition to that, because the Cancer Supporting Palliative Medicine Access Program needs augmentation or help, there is also another one which is called Cancer Assistance Program, Cancer Assistance Fund, which covers other cancer medicines that are not available in the CSP map or the Cancer Support Palliative Medicine Access Program. And not just the DOH programs that I mentioned, I believe, like the Philippine Cancer Society, other foundation, the other advocacies, they have programs that help the patient. So you have to be able, you have to ask the doctor who will guide you and tell you where you would seek help. And even the PCSO or the Malasakit, DSWD, so like what Mommy said, if there's a will, there's a way. We have so many assistance going on. So we just have to take a step forward so that our patients or the patient can be helped despite the cost.
Okay, thank you.
Thank you for that, Doctora. I think also from the story of Miss Nelia, no, there is an initial shock talaga when we get the diagnosis and they talk to us about the treatment. Paano ko gagawin yun? But as the shock sort of dies down little by little, we do get educated about the many ways that we can be helped in our treatment. So thank you for that. Are there any more questions from the floor? Yes.
Hello. Jean Mangalas po from Inquirer.net. This is for Dr. Chavez and Dr. Panete. May I just ask if there are any links between long COVID and lung cancer, because there are effects, because COVID attacks the lungs. So are there any links between the two diseases, or there any treatment or between the treatments? Are there any ongoing studies about those two diseases?
Siguro from our pulmonologist first.
Yes, good afternoon po. It remains to be seen kasi kaka-umpisa pa lang ng COVID. Pero siguro, ang tuberculosis kasi, there is such a thing as we call scar carcinoma. Hindi naman siya gano'n kadami, but merong ibang mga tuberculosis patients who had tuberculosis and had a scar. After many years, yung scar na yun, pinanggagalingan ng pwedeng nagiging cancer. Pero after many years pa yun. So, it remains to be seen kung meron ng, kasi di ba ang COVID, it causes scarring then of the lungs. So, hindi pa naman, pero yung scarring kasi sa COVID, hindi siya localized. Yung tinescribe ni Dr. Valete kanina parang naka-flashlight. Hindi siya localized sa COVID. Maraming parts ng lungs yung affected. So more of ibang klaseng lung disease yung so far in the past, since 2020, ibang klaseng lung condition yung nakakos ng long COVID. But it remains to be seen kung merong areas ng scarring na yun na pwedeng panggalingan ng lung cancer.
From the oncologist point, there is no definite claim that you can say it is proven that there is association with lung cancer.
So still very early in the game. Any other questions from the floor? Yes.
Good afternoon, mga doctors and sa mga doctors po natin. And my name is Jay Mande of Destination. Question lang po. Kasi usually po, na nakikita natin is on the treatment side, right? So, paano yung prevention para hindi makuha yung certain na disease? Paano natin i-promote? Paano natin i-advocate or i-educate yung bawat isa, especially in the Philippines na most of the Filipino people are smokers or they are inhaling polluted air. So paano natin, as a doctor, paano po ninyo i-educate o i-advocate yung kanilang para maiwasan itong certain type of disease? Yun lang po. Thank you very much.
Thank you, sir. Dr. Chavez, how do you communicate with your patients about the prevention of lung cancer?
Maraming salamat sa tanong na yun. And also, dito, itong opportunity that we are having right now talking to you, we are grateful that you are here para you can help us spread the word. Siyempre, ang pinaka-maganda is prevention, di ba? So, if you are a smoker, siguro isipin din natin na hindi lang yung sarili natin yung pwede natin i-harm, but also the people around us, our family or our friends who are always exposed to us. Kasi kagaya ng nabanggit ni Ma'am Nelia kanina, ang gastos ng chemotherapy, ang gastos ng treatment for lung cancer. So, hindi lang siya financially burdensome. It can also be emotionally, physically, psychologically burdensome. So, ang sa akin, when I talk to my patients, I try as much as possible not to impose anything on them. Kasi mga adults naman yung mga pasyente natin, meron na yung mga sariling desisyon. So sa akin, importante na naiintindihan ng mga pasyente or ng tao kung ano yung mga risk factors ng lung cancer, paano niya mape-prevent. Ang kagandahan doon, kagaya ng pinakita kong slide kanina, yung lung cancer, pwede mo na siyang ma-detect early. Kung meron kang risk factors na ng mga nabanggit ko kanina, 50 to 74 years old, malakas manigarilyo, kung nag-quit ka, okay na yun, pero kung less than 10 years ka pang hindi nag-quit, pwede natin i-screen. Pero yun nga, in the future, sana aalamin natin kung pwede natin idagdag yung kung Asian ka, or meron kang family history ng lung cancer dun sa criteria na yun. Kasi pag na-detect mo yun early, at pag tinanggal mo yun, wala nang kakalat sa ibang parte ng katawan. So pag na-detect siya ng maaga, at natanggal mo siya ng maaga, merong chance na magamot. Diba? So yun. Importante lang is naiintindihan. Kaya na-appreciate namin yung mga tanong ninyo. At magandang opportunity na nandito yung mga friends natin from the press. And yun, if you can, thank you for helping us spread this advocacy. Smoking is the #1 cause of lung cancer. Tapos yung mga indoor-outdoor air pollution. At tapos yung vaping and other forms of alternatives to smoking, hindi rin siya safer options. Kasi hindi siya yung laman ng vaping or other options na minamarket, merong mga ibang laman yon na chemicals. Ang laman nun kasi usually yung ginagamit pang embalsa mo. Oo. So, yun, pwede mag-cause yun ng lung cancer. So, basically, making the patients, their family, and friends understand kung ano yung risk factors at ano yung mga risk factors na pwedeng ma-modify at mabawasan. Sana nasagot kayo.
Yes, thank you, Dr. Chavez. We have another question?
Good afternoon. My name is Kathy Cruz of Tuklasin natin, and this is ang ating curriculum Among the 5 pillars of cancer treatment, what is the cheapest, most effective treatment, and most recommended by pulmonologists or oncologists?
Siguro we'll give this to Dr. Valente.
The question is somehow difficult to answer because now, aside from the one I mentioned, if we can employ surgery, surgery goes first, and after checking the specimen, there is a need to give chemotherapy or radiotherapy. We talk with the patient, call the specialist, and advise the patient surgery plus like this, or something we add on. Now, aside from that, we also test the specimen because nowadays we practice precision medicine. We do not just give targeted, blinded. We have to test the specimen if there's a target. So, there are so many things that we have to do, like testing the specimen, checking it, like what Mommy said, her GFR was negative. If it is negative, she's candidate for chemotherapy. So it's not just a comparison, but it's like wearing the proper costume or proper clothing that would fit the patient. So it's tailor fit and precise.
I think when we say options for treatment, hindi po ibig sabihin na I will choose option 1, 2, or 3. No? It's not one size fits all. It's determining what is best for that stage and whatever other characteristics are present. No? So I will go back to one of Dr. Balette's slides, which is the picture of the multidisciplinary team. It's a team of doctors trying to decide which course will be best for each patient. No, any other questions? Yes.
Good afternoon po, Larissa from Manila Society. Question ko lang po, besides financial, problema natin, emotionally and psychologically affected din po yung mga patients. Do we have a support group, that could help us parang guide them with regards din, kasama na rin po pati kung saan pwedeng lumapit, mga financial institutions? Do we have an existing group for lung cancer patients?
Perhaps Dr. Valente and maybe Ms. Nadia after.
Kasi ako lumalapit ako dahil sa Philippine Cancer Society. Like dun sa QualiMed, nakiusap ako doon. Para doon ako magpahimo na hindi masyadong mahal. Mga kaibigan na walang sawang tumutulong sa akin sa ngayon. Nagbibigay ng lakas ng loob, nagdadasal. Yung paghingi ng tulong, kung marami kang kaibigan na madaling lapitan, na hindi sisinuhin kung ano yung hinihingi mo, wag lang malalaking halaga, marami pong tutulong sa atin. Totoo yun, ang pagpapagamot ng cancer talagang naging kalbaryo sa akin noong unang malaman ko yun. Hindi ko alam saan kung kamay ng Diyos kukunin ang pera. Ang tagal bago ko nakapagpakimo. Dahil naghahanap ako talaga ng taong tutulong sa akin o ng kumpanya na tutulong. Hindi ako pwedeng lumapit sa DOH. Sila nagsasabi na wala silang gamot. Gamot lang ang hinihingi ko, hindi ako humihingi ng pinansyal. Wala daw silang ganito. Meron namang isang doktor, inilalapit ako sa medrep, hindi ko naman kayang bayaran yung 20,000. Saan ko naman kamay ng Diyos kukunin ng 20,000 piso every 21 days? Ang isang ospital na hindi ko nasasabihin ng pangalan, ang pinakamurang maibibigay nila sa akin na chemo is 77,000 per session. Mamamatay na lang ako, makadulat ang matay. Sana po yung mga parmasyotikal, maawa kayo sa aming mahihirap na magbigay naman kayo ng libre. O hindi man libre, malaking discount, hindi po ba? Kasi katulad po namin, Katulad sila nananapitan ko ang Philippine Cancer Society. Bata pa ako, unang na-diagnose ng cancer ang kapatid ko. Nagpapacheck up na ako nung may clinic pa ang cancer sa Philippine Cancer Society. Kaya alam kong silang pwede kong lapitan. Nung una nasisiraan ako yung dahil akala ko wala na. Buti merong Qualimed na tumulong sa akin. Mahirap pong bunuin. Lahat ng herbal tinikman ko. Bumili ako ng herbal na panggamot ng every 10 days is parang 13,000. Pinikit ko yung mata ko. Doon sa Antipolo. Hindi ko malunok kung ano lasa ng mga gamot. Tinapong ko din. So sabi ng anak ko, magloloan na lang ako sa opisina. Umalis ka na dyan. Tigil mo na yan, sabi niya. Kasi yung 10 days ko, nakaka 8 days pa lamang ako na nag-herbal. Bumaba na ng bumaba ang timbang ko. Mas lalo akong natakot kasi hindi ka pwedeng kumain ng kanin. Hindi ka pwedeng kumain ng ulam. Puro lang yung mga dahon-dahon na binibigay o yung mga tableta na hindi ko maintindihan kung ano mga tableta yan. Mga iniinom na mga hindi ko talaga alam, hindi ko maintindihan. Sa loob ng 8 araw, na 100, dati ako 180 pounds. Naging 154 ako, hindi na ako halos makatayo. Kaya pinigil ko po yan. Nagbalik ako sa doktor. Pero sana nga matulungan tayo ng mga parmasyotika. Huwag naman masyado kumal ang mga gamot.
Thank you, Ms. Nalia. Dr. Valete, any places that you point your patients to for emotional and other forms of support?
Within a certain treatment facility, normally there is a support group. But you have to take the step to ask the doctor about existing support group of that institution. And these are patients of the institution that form a group so that those who finish the treatment will support the other ones who are new, or ongoing treatment, they support the ones who are new. And also, as you can see in the multidisciplinary a while ago, there is the so-called palliative medicine and palliative and supportive care medicine, wherein these specialists are being told to give the necessary psychosocial, emotional, mental, these things support to the patient. So these are normally they are really called in, especially when the patient has a very poor family support. Kasi among the support that we mentioned, family support is also very important. So there are those patients wherein family support is not that good. So they really need external support. As what Mommy mentioned a while ago, di ba? You said na your family is supportive. So that's a big boost to her so much than those without family support.
Everyone goes through cancer, not just the patient, the family as well. We'll have our last question. Yes, Papa.
Doctor, after a patient has had COVID, how often does he or she have to have her lungs checked, and how often does he have to do that?
Dr. Chavez?
I think it varies on the severity of the COVID and the symptoms of the patients. Kagaya ng cancer treatment, walang one size fits all. Depende sa nararamdaman ng pasyente, sa severity ng damage sa lungs po. Kung ano po yung mga tests na gagawin and how often.
So best to consult regularly with your attending pulmonologist or internist, yes? Yeah, so much sense. I think we are winding down, but we can entertain one more question.
Okay. Another question, perhaps this is the last. What can you say about the use of natural or alternative medicine, or the so-called herbal medicine plants to cure lung cancer? Is there any?
Yes, that was a question I was waiting for.
I'm asking as medical oncologist, Dr. Soledad Bolete.
Yes. Doctor, if I may add, you mentioned also, in line with that question, some might confuse also what immunotherapy means, right? Because a lot of herbal institutions also say that they are just boosting the immune system, and then they equate it with immunotherapy, sometimes even infusing high-dose vitamin C. So maybe how do you communicate with your patients about questions such as this?
Dr. Cowton is also a medical oncologist, so I'm happy that she's here to add up. So the difference in this medicine is that if you recall the COVID time, I remember when my uncle got COVID around May of 2020. We thought he's going to, not going to make it. Kasi at that time, all the options are not proven. So the very big difference of this, such as immunotherapy or those targeted, these agents, before they can be allowed to use, they have to undergo studies and research. So they are not just saying word of mouth, take this, because we're after the safety and the efficacy. And in order to prove the safety and efficacy, remember we're dealing with human lives. What if we're taking it, something happened? So these medications that we're using are not allowed to be used unless they have been studied well. The what we call the phase 1, phase 2, phase 3. No? So it's not just basta you use it. So if we say this is allowed, it has already undergone series or phases of research. So for the safety, efficacy, effectiveness of the medication, so that you can see the result.
Thank you. So I think that has been a full afternoon for all of us. Thank you to everyone, Dr. Chavez, Dr. Valete, and Ms. Nelia, for being so generous with your time and your knowledge with us this afternoon. Thank you also to our partners with us today. We hope that you have more confidence in spreading the word and awareness about lung cancer. Thank you, everyone.
Thank you very much, Dr. Pauline and Veronelia Carlton, Dr. Christine Chavez, Dr. Soledad Palete, and Ms. Nelia Patage for your insightful sharing. And of course, thank you to the Philippine Cancer Society Director, Dr. Rachel Rosario, for gracing this event. On behalf of AstraZeneca Philippines and partnership with the Philippine Society of Medical Oncology, thank you, ladies and gentlemen, for taking part in the Lung Cancer Awareness Month. Let's take the plunge. Together, let us spread better awareness of lung cancer, its prevention and proper intervention. Enjoy the rest of your afternoon and stay safe. Good afternoon once again, ladies and gentlemen. To the owner of the vehicle with plate number NGI8172, your parking pass is at the concierge. Once again, to the owner of the vehicle with a plate number NGI8172, your parking pass is at the concierge. Thank you.